Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Welcome to Wellness Wednesday with 3W. Hello again, this is Helen Nguyen, CEO of 3W Medical for Women. I'm here and joined by none other than Dr. Susan Rutherford, our president and medical director. Hi, Sue. Thanks again for joining us.
Hi, Helen. Yep, good to be with you.
Thank you. Today we're talking about a pretty common issue that happens during pregnancy, nausea and vomiting, which are not fun.
No, they aren't fun.
Gosh. Okay. So, why should women know more about nausea and vomiting during pregnancy? How many women have this issue?
Well, lots. And knowing about it early can help them because often they'll have the symptoms starting well before they start having their medical appointments.
Oh, wow. So you could have these symptoms before your first ultrasound?
Yes. Mm-hmm.
Oh my!
You can have them very early.
Okay.
Well, a lot of times there's difficulty getting into the doctor's offices to be seen and all of that.
Mm-hmm.
So probably at least half of all women, maybe 80% will have some difficulty with nausea and vomiting, or at least have the symptoms.
Okay.
Not all of them have a big problem with it, but a lot of them have the symptoms.
Okay. Do you know if it's a genetic issue?
Well, it's interesting that you asked that because there are some rare cases that are thought to have some genetic component, but it has to do with hormone receptors and problems within cell mitochondria, which is some of the machinery inside the cell. Okay. But when you talk about genetic, in other words, is it in the family?
Yeah.
That's not clear.
Okay.
I mean, nobody's identified it as specifically familial.
Okay. Yeah, because I was just thinking of the women in my family, and I know the women in my family never had nausea or vomiting problems, so that's why they gained a lot of weight during their pregnancy. Sorry, Mom. But my aunt-in-laws all had nausea problems. And it was just very interesting to see, like, okay, well, you're not blood related, so you'll probably have nausea, is what we always said.
Well, the weight gain's interesting because one component of the nausea and vomiting isn't necessarily where the woman will identify as feeling nauseated, but she feels hungry. Oh. And so probably the eating is a response to some component of that whole nausea and vomiting spectrum.
Okay. And when does nausea and vomiting become a problem?
So it starts before 9 weeks. If it starts after 9 weeks of pregnancy, in other words, if they had none and then after 9 weeks, they start having it, then the suspicion needs to grow for other medical problems. Specifically, thyroid is one of the more common reasons that somebody might have it that's unrelated to pregnancy. Okay. So basically it starts before 9 weeks. Most of the time it resolves by 14 weeks. Okay. But there are a few people where it continues long term, even throughout the pregnancy. I've had patients who have had to be on supplemental feeding. They couldn't eat throughout their pregnancy. Yeah. They carried a backpack and had a little tube either going into a vein or even through their nose down into their stomach with a drip of food.
Is that called a feeding tube?
Yeah,
then?
A feeding tube.
Wow,
that's
a little
intense. Tiny feeding tube. Yeah. So fortunately, that's pretty uncommon.
That's uncommon. Okay. Yeah. That's good to know.
Yes.
Okay. And for women that start having nausea and then it kind of goes away, will it ever, like you said, it comes back? Then that's a problem. But if it doesn't,
come back
it shouldn't come back.
No, it shouldn't come back. Once it's pretty much resolved.
Okay.
If it does come back, then we start thinking about other reasons that she's feeling nauseated that are unrelated to the pregnancy.
Okay.
Specific medical problems.
Okay.
Yeah.
And is it triggered usually by food or
sometimes smells?
Smells? Yeah, that's
Yes.
got to say that.
So one of the suggestions I read someplace was have somebody else empty the garbage.
Oh,
I'm sure there are a lot of women that would like to use that as a, hey, you know what? I'm having nausea. Will you please empty the garbage?
I should use that.
Yeah, you could use that.
I could use that as not even being pregnant, just saying that to my husband.
Yeah. Well, it's interesting. There are a couple of other things that are associated with it. One is motion sickness. So women that tend to get motion sickness often are more afflicted with the nausea and vomiting. And if they get it, it might be more on the severe side.
Wow.
Yeah.
Okay.
So the other thing is people that get migraines. They often may be more prone to it.
Okay. One
other interesting thing is people that are sensitive to certain food textures.
Textures?
Yes. Okay. So, I've never been pregnant, so I can't decide, I can't know if I ever would have gotten nausea and vomiting, but there are certain food textures that I cannot tolerate that will make me practically throw up flan.
Yeah, or yogurt. You don't like
and
yogurt?
Yeah.
And sour cream?
Sour cream? No.
Yeah, none of that heavy, creamy stuff.
Right.
Huh.
So people that have trouble tolerating those can have more difficulty too.
Wow. Okay.
Yeah. So of the women that get it, or of all women, basically, those that have it severe enough to be called hyperemesis. Emesis means vomiting. Okay. Hyper, of course, means more. Lots. About 3% of women get hyperemesis. Wow. And it's defined in various ways, but basically if labs are drawn, if blood tests are drawn, they can have an imbalance in their electrolytes, their sodium, potassium, chloride, all of that. Okay. They can, if they lose maybe 5% of their pre-pregnancy weight, then that would qualify them as for the diagnosis of hyperemesis. Okay. Yeah, a lot of times we don't necessarily prove everything. They might have ketones in their urine, which means that they're in a fasting state because they can't keep anything down. So mostly if it's more severe and if they're starting to get really concentrated urine and getting a little bit dehydrated, then we'll treat that as if it's hyperemesis. It's with IV fluids first of all.
Okay. Yeah. How does this impact the baby?
It doesn't appear to impact the baby.
Oh.
Yeah. So the only thing would be if somebody was so sick that they were completely dehydrated. But the body is pretty good at protecting blood flow to the uterus. Wow. So there isn't really like a chemical imbalance or anything. You just need the adequate blood flow to the uterus. So but no correlation. It is possibly associated with the pregnancy hormone, HCG, human chorionic gonadotropin, and that's the hormone that's tested for a pregnancy test. Okay. People that have twins or triplets and have bigger placentas have higher levels of HCG, and they have a bigger problem with nausea and vomiting. Okay. So nobody really knows the cause, but there is a correlation with the higher HCG levels and having more trouble with nausea and vomiting.
Okay. So if you have a lot of nausea and vomiting, though, and you can't keep food down, and you're supposed to be, they say eating for two, is that going to impact the baby at all?
Well, eating for two is really, there's not much difference between eating for two and eating for one when you're pregnant, especially early.
So
baby's not that big. No. Yeah, that's sort of a myth. Yeah.
Oh, okay.
If you took two adult amounts and ate, you'd putting on way more weight than you want to. Yes. Okay. So I think the most important thing is staying hydrated.
Okay.
Yeah. It's good to get in some nutrition too and not have the ketones, but women who are diabetics late in pregnancy, if their diabetes gets really out of control, and they have high blood sugars and they get ketones in their urine and in their blood, they can get extremely sick. I mean, it's potentially life-threatening. And in that situation, it can alter the blood flow to the baby and the babies can be in trouble. But that's
rare.
That's the later part of pregnancy too. Okay. So early, the first trimester really is, it's not an issue for the baby.
Okay.
Yeah.
How is it managed?
So the first thing is just diet. What you eat, when you eat it, that sort of thing.
Okay.
Oftentimes, I mentioned textures. So it could not necessarily be just the texture in your mouth, but the texture in your stomach. Because one thing that seems to help women is if they separate by a time gap, 20 or 30 minutes, their solids and their liquids. And so if you drink your water, or if you have juice or something like that, drink that and then don't eat any solids for 20 or 30 minutes, and vice versa. Eat the dry bread, the crackers, whatever, and then wait, give it a good gap before you drink the water.
Okay.
Then a lot of times the stomach tolerates that better. A lot of times the dry stuff is easier on the stomach.
Yeah.
In fact, this works for post-operative people too. People who might be nauseated after surgery. If they start, especially if they've had abdominal surgery, say C-sections, if they start nibbling on dry crackers and things like that, it kind of stimulates their intestines, but they're less likely to get nauseated and all the gas. So when women that are really having problems in the morning, if they keep some dry crackers, saltines, or something like that by their bed, and before they get out of bed, nibble on that, or dry bread or something.
Yeah. How about dry fruit? Is that okay? Or is that?
That's okay. I can't think how that would, I'm not sure that would have the same therapeutic effect.
Okay.
But I just don't know.
Okay.
And a lot of this ends up being trial and error. So people have preferences for certain flavors and smells.
Yeah.
And smell is a big part of how we appreciate food too. A lot of women will report that their tastes and their food preferences actually change in pregnancy.
Yeah. Yeah.
So that's, So they just have to kind of trial and error and adjust to whatever seems pleasant to them and that seems like it'll stay down.
Okay.
Yeah.
Do you know why during pregnancies some of our food preferences change?
No, I don't know.
Okay. Yeah, because I had a friend that could not stand mayonnaise. And then when she got pregnant, she could not stop eating mayonnaise on everything.
Wow.
Yeah,
wow.
It was like so weird.
That is.
It's just, it just changes things.
It changes things. Yeah.
Yeah.
So that's normal.
Yeah.
That's normal. And I say the most important thing is staying hydrated. So if you don't get in a lot of calories, don't worry about it. The body has mechanisms for breaking down some of the stored fat, for bringing forth some of the stored glucose. Even some of your muscle and protein structures can break down a little bit and provide amino acids to circulate in your bloodstream. So the main thing is staying hydrated, because if you don't get good blood flow to all your organs, that's when things really start not to work well.
Yeah.
Yeah.
Okay.
So that's when we basically in the hospital will give them fluid, might admit them. They're dehydrated. There are some people that come in like every 2 or 3 days and get an IV liter of fluid and then go home.
Yeah.
Then they're back another 2 or 3 days later and get another IV liter of fluid and tank them up and go home. And
my aunt-in-law had to do that.
Yes.
Yeah, with her second pregnancy, because she could not keep liquids down.
I remember 2 pediatric residents one time where I was working at an academic hospital and they were married to each other. And every night he started an IV on her.
Wow.
And she'd get a liter of fluid overnight, and then they'd go to work.
What?
And then the next night they'd do the same thing.
That is
I think she was off of night call at that point.
Yeah.
Because she was otherwise so sick. But that's what kept her going, was quite a few weeks of getting liters of fluid at night.
Wow. And can you start one pregnancy with having really bad nausea and vomiting, and then the next
have no symptoms?
Have no symptoms?
Yes. Oh. Every pregnancy is different.
Wow.
Yeah.
Okay, so it doesn't mean the first pregnancy kind of sets the tone for the rest of it.
No. It's different all the time. People that have the more severe problems, they tend to have it recurring. But not necessarily as severe, but escaping without any nausea and vomiting is not as common when they've had real trouble in a previous pregnancy.
I heard eating ginger could help.
Yes. There are some people say it doesn't work at all, but it's one of the best natural remedies. And there are ginger candies that you can eat. I've heard the Trader Joe's makes good ones.
Yes, we love those.
And my niece took a ginger root. You buy those funny looking roots in the grocery store.
Yes.
She put it in a big jar of water, a big mason jar in the refrigerator, and soaked it. And that's the water that she drank or used to make tea or lemonade or something.
Yeah.
She used that water, and then she'd just keep refilling water and keep soaking the ginger. Yeah. And that really helped her. So
that's what my mom would do when we were sick and we were little. I get motion sickness really, really easily. And she would always soak some ginger root in some hot water and some honey.
Oh,
and that's what she would give to us.
Yes.
And it would make things better.
Yes. Yes, I can believe that. Yeah.
And what if those natural approaches, or is there a medication that you can take?
There is medication.
Okay.
So, and it can go from something as simple as taking vitamin B6 to adding in an antihistamine variant. It's a cousin of Benadryl.
Oh.
And it's marketed as Unisom.
Okay.
And taking some of that along with the vitamin B6. Of course, the antihistamine can make people sleepy. So this works some of the best for women that have morning sickness, where the morning's the worst time for them, because then they can take some at night and they're going to sleep anyway.
Okay.
And they'll feel better in the morning.
Okay.
So they can also take some during the day. But if you're taking some of these drugs, if you start taking a lot of them, they can make you sleepy. And some of them are similar to what are used to deal with nausea postoperatively, or when people are taking other medications like chemotherapy. And so depending on which ones they are, you have to be careful about operating machinery, driving.
Okay.
Because you could be, less
sleepy,
responsive. You could be more sleepy. Yes. Yes.
Yeah.
But so some of them are very mild and minimal and just available over the counter.
Okay.
Years ago, there was one that was the combination of this, basically the Unisom type medication and the vitamin B6. Okay. But the lawyers decided to sue because there were birth defects. Well, the natural incidence of birth defects is 1% to 3%, depending on how mild or severe you're talking about. And so, of course, there are going to be birth defects all the time. And everybody was taking this. And so they started suing. The company said, hey, this is cheap. We don't make much of a profit. We're just going to stop making it.
Wow.
And so then we started coming up with the over-the-counter recipe that we'd hand out to women for years. Now there is one medication that has gone through FDA approval, but it's not cheap. And some of the insurance companies won't pay for it because it's not cheap. But it costs so much money to get it through the FDA study process and get it approved that's why it's expensive.
Yeah.
There's another one that's apparently a little less expensive that is not FDA approved, but it's basically similar to that one. But Medicaid won't even pay for that. And it's really a shame because the alternative, if you can't adequately manage this, the alternative is bringing a patient into the hospital, the emergency room or the obstetric unit that has their own little emergency, unit, and giving them IV fluids. And just one visit like that would easily pay for the prescriptions that would prevent the patient having come in. So it's really a shame that it's not more widely used. So instead, they want you to use some of the chemotherapy, anti-nausea medication has been around for a long time, like Zofran, and so that's gotten less expensive. There have been questions raised about the safety and risk for heart defects. That's been pretty much debunked or said no, that there really isn't a risk, but that question's not 100% answered. So my preference is to start with the ones that we know are safe and then go to that. There are other medications that sometimes are used for mental health reasons, anti-anxiety, for example, and those can be helpful as well. But once you start getting into prescription, again, it's trial and error. Oh, there's another one that's used to help speed the stomach emptying, and diabetics take that a lot. And so that's another alternative. That's less likely to cause the side effects of sleepiness.
Okay.
But you're trial and error all these things and see what combination seems to work for women. If they get so far that these oral medications aren't doing it, that's when they end up in the hospital.
Yeah, yeah. Do prenatal vitamins cause nausea?
Yes. But I wouldn't say that they totally cause it, but they're one of the things that the stomach doesn't tolerate as well.
Okay.
Particularly if it's empty, like in the morning.
Yeah.
So for any women that have nausea and vomiting, they're probably better off taking their prenatal vitamins in the evening, like after supper.
Yeah.
And that seems to be much better tolerated.
Okay.
Yeah.
Does nausea and vomiting during pregnancy have any correlation with cravings?
Not that I've read anything about that. I haven't seen any association. You talk about pickles and things like that.
Yeah. No.
No.
Okay.
Everything it's different for every patient.
Yes.
And so it's really important to sort things through, kind of do a stepwise, try and make one change at a time in your diet, your schedule. You're adding a medication, subtracting a medication, one step at a time, because then you can figure out what it is that's
causing
helping and what's helping and what's not helping and what. If you do it stepwise, that will work. The thing is, that means an awful lot of doctor visits, because you but that's what should happen.
Yeah.
Is somebody walking with the patient through that process.
Yes, and we do that at 3W.
Yeah, we do that. And we hope to, we're trying to get people established with somebody who will get to know them early in their pregnancy and help them through all those things. But it can take a while for them to get an OBGYN appointment or a midwife or whoever they're going to see.
Yeah.
And so sometimes they're going through the worst part of this. So we've periodically seen women and I've said, okay, I want you to come back in a week because if this doesn't work for you, then I want to try something else because I know they're not going to get an OBGYN appointment in a week.
Yeah, and it's no fun being that miserable.
No.
You already are kind of, wow, I'm having a baby, so you got to wrap your mind around that. And then now you're feeling crummy. Right.
And then we can dip their urine and see if they're really high in ketones. The keto diet.
Yeah.
Okay. Yeah. So the keto diet is having few enough carbs that you end up with positive ketones in the urine. Okay. And so it's similar what happens when people are nausea and vomiting. And during pregnancy, babies actually like glucose. The growth of the baby needs some glucose and it can be broken down in your body. So they're not starving.
Right.
But it's certainly better if you can keep up on it.
Okay. Well, you heard it from Dr. Rutherford. You're welcome to come by. If you have any questions about, your nausea or vomiting during your pregnancy, we see all of our pregnancy patients for free. And the consultation with Dr. Rutherford is completely free of charge as well. So please take advantage of her knowledge about the subject. And, she's how many pregnant patients do you think you've seen in your
how many thousands?
How many thousands?
How many tens of thousands?
You've lost count, huh?
Oh gosh. Yeah, I thought when I started my career I was going to keep track of, especially like the number of babies I delivered.
Yeah.
That lasted less than a year.
Oh. Well, you've heard it. You've heard it from her. She's seen, do you think you've seen
I haven't seen everything. I haven't seen everything. Oh,
okay.
No. And so my basic rule of thumb is the patient is the best textbook. Okay. So you see what happens with the patient, why certain things work, why certain other things don't work, or what should work. Okay. And so you kind of follow that path and for that patient, see what works. And it's really just a process of working with the patient. That's the most important thing.
And not
working
looking
with the patient.
And not looking at the approach as like one size fit all kind of situation. Right?
Well, and that's really important for patients to know and their families to know is there's not just, oh, you have this and this is the treatment. There you go. You're done, finished. The families need to know this takes patience and it takes a lot of work for the patient to herself figure out. Yeah. Because that's what's really going to provide the answers. The patient understanding, hey, I feel better with this, or I feel worse with this, or, that's what's crucial. Yeah. And it's a process and it's different for everybody.
Everyone.
So I know I haven't seen it all.
Oh. Well, what are some last tips or advice for women that are going through nausea and vomiting during pregnancy that you have?
First of all, don't panic.
Okay. That's always good.
Yeah. Don't panic. Try and focus on staying hydrated, fluids. Okay. Plain water is good, but if you can add a little flavor to the water, if that makes it stay down better or makes it more tasty to you. The other thing is brush your teeth. I know that sounds strange, but especially if you're vomiting, what comes up from the stomach is acid, and that can affect your teeth enamel. So
Didn't
keep
even
your
think about
mouth
that.
clean.
Yeah.
Use toothpaste. You might have to change toothpaste to find something that tastes good.
Yeah.
I wouldn't worry about exact treatment of toothpaste, but
Okay.
brush your teeth and keep your mouth clean.
Okay.
That will probably help.
How about mouthwash?
Yeah,
Is
that would be
good too?
great. That would be great. Mm-hmm.
Okay.
Yeah.
All right. Does it affect the coloration of your teeth at all? Do you know?
No. But
Okay.
it could, if you vomit a lot, then it'll eat away at the enamel. It's very interesting that the number one reason for hospitalizations during pregnancy that don't lead to delivery is premature labor. The number two reason is hyperemesis of pregnancy, severe nausea and vomiting. That's the number two reason that women are hospitalized during their pregnancy.
Wow. Okay. Well, you've heard it, folks. Hydrate, hydrate, hydrate.
Yes. Yes.
That will be your lifesaver.
And eat what tastes good.
Yeah.
I mean, I remember...
In moderation.
Yeah, in moderation. But I've had patients say, well, all I really feel like eating is those really sugary donuts and salty potato chips. It's like, if that's all you can eat, go ahead. For now, not for long term.
Well, very good. Anything else you wanted to tell our listeners, Sue, that they should know about? Anything else? I think we covered a good deal of it.
I think we did.
Yeah. Well, thank you so much again. I always learn so much from these podcasts with you. And, who knows if I ever will be pregnant or not. But if I'm not, then I'll pass it on to my friends about this kind of stuff. That ginger kind of candy at Trader Joe's is so good. We eat it in the clinic, even though we're not nauseous. So there's a plug for Trader Joe's.
Yeah, I was going to say, maybe we should go to Trader Joe's and share our podcast and say, by the way, do you make charitable donations? Because we'd love to have support so we can keep serving women this way.
I know. Well, this podcast is not sponsored by Trader Joe's, but we really love them. So hopefully they will sponsor something in the future. So, well, thank you so much, Sue. Thank you to our listeners. If you're suffering or dealing with nausea and vomiting, please give us a call and make an appointment with Dr. Rutherford. She is a wealth of knowledge about this topic, and it's free to you. So come on down. Thank you so much. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.